Welcome to one of our special Shrine University live streams. We are so glad to have you with us this afternoon, and I'm so glad that you're actually taking some time away from studies online, maybe your Zoom calls, just to really be with us and inquire about what's going on at Shriner, looking into these fields of study. If you have any questions, please by all means just chime in, let us know. But I definitely want to introduce Dr. Sparks, the Director of Nursing. So I'm going to pass this over to Dr. Sparks.
Thank you, and welcome everyone. I am the current director of the nursing program at Shriner University. There are two tracks, one program, two tracks, and I'm just going to touch on the OBSN or the online BSN track. I know that's not the track that you're applying for, but you may know someone, so I'm going to put a plug in. You may know someone who's interested in the online program. They're an associate degree nurse or diploma nurse, and they're wanting to go back and finish their bachelor's. So we oversee that program. We have about 90 students online completing their baccalaureate degree as we speak. And then we have a traditional program, which I will be speaking to today. When you come to Shriner and you're admitted into the program, you'll hear us talk about the program and the different tracks. And so it just gives you an idea of what we're referring to when we speak to the two different tracks. We have a 2-year program, and there are 2 years worth of prerequisites. I say 2 years and I say prerequisites kind of tongue in cheek because some students finish the prerequisites sooner because they started in high school or they go year round. And so it's about 2 years if you do traditional, if you go in the summer, in the fall and in the spring. And a couple of requirements about the program. We'll start there and then I'll roll you through all the way up to being enrolled in the program. One of the requirements is that on the prerequisites, you take general education courses along the way. So you have to take English and history and math and science and government. But there are specific courses that are specifically prerequisite to the RN degree. And they're fairly standard across Texas. They may be a teeny bit different in another state, but they're fairly standard across Texas. And those courses, we require a score of B or higher. So you need a B or higher in those courses. There are some students who might struggle, for example, with nutrition, or they might struggle with micro, or they may have just had a bad semester, something was going on personally. This might be an example of a semester where things are going on personally. They didn't do well in a course. They simply have to repeat that course because they need a B or higher. That's one of the requirements. And they need an overall GPA of 3.0 or higher. There's also what is referred to as a TEAS exam. It's a entrance exam that you will be required to take, and you can Google it. Google's your friend. You can certainly email us. We're happy to provide you with additional information, but you have to score 75 or higher on the TEAS test also. And part of the caveat is that you have 2 attempts. And so for some folks, that's great. Hey, I didn't get it the first time, I'll get it the second. For some folks, that's stressful because they only have 2 attempts. Now you have 2 attempts within one application period. So the way the application period works is as follows. We admit 1 time a year and we graduate 1 time a year. So we admit 1 time, we graduate 1 time. It takes 2 years to get through the program. So we graduate because somebody's in the pipeline. So we graduate, every May, and we're admitting for every fall. So we admit 1 time a year and it's in the fall. And right now our deadline usually ends by mid-April because I have to turn in a form to the Board of Nursing with a list of our students. So in part of the application process, we use a system called CAS, C-A-S. And CAS is a repository to apply. And what's great about it is you can apply for several schools at the same time. So you start your application, and you can start it kind of early. So let's say that you're in your sophomore year and you're just starting your third semester. You know, you've been a freshman, you could start your application. It just stays in a queue until you hit submit. It's almost like an email where you save your email, and they ask you for shot records. They're going to ask you for a couple of reference letters. So be thinking about a couple of professors that you have. They will ask you to write an essay about why you want to be a nurse, what it means to you, what's the reasoning behind what you're thinking. And in that essay, be sure you do a rough draft, because we do grade it on a rubric. The whole admission process is graded on a rubric. And we do look at your grammar, your originality, and your thinking inside the letter. So absolutely, it's not just a task. We absolutely look at that letter. And sometimes when we read the letter, bless you, sometimes when we read the letter, we will ask you questions during the interview process about something you wrote in the letter. So there's a letter that you submit, and once you submit your transcripts, all that's kind of uploaded. When you finish, you hit submit. It pushes over into our repository. We pull you up. You meet all the requirements. We set up a phone appointment with you. Well, I say a phone appointment. We usually do a face-to-face interview. We've been doing FaceTime or Zoom or Teams right now because of COVID-19, but we normally do a face-to-face. And during the face-to-face, we ask you some additional questions. And we also like for you to come in and ask questions about the program, clarify things. We want you to get to know us a little bit during the interview, and we like to get to know you a little bit. So the interview usually runs around 20 minutes, 30 minutes at the most. And so that's kind of the process. I kind of walked you through the application process. On our homepage, on the Schreiner Nursing homepage, there are a list of the general education courses, prerequisites that you need. And so you can always, and also the additional requirements, like I just mentioned, the 2 reference letters, the essay, all of that is listed. The immunizations are listed, which immunizations you need. So all of that criteria is listed there on the homepage, and you can almost just kind of copy and paste it or drop it into a Word document. And then you have your self-made checklist that as you're going through, you're checking things off. Nursing students, pre-nursing students, nurses, we're list makers, we're task oriented. Feels really good to draw a line through something, check something off. I'm done with this task. And so that's a great way to kind of put things into perspective, is pulling that up. So you finish your interview, we calculate your score. There's a certain cutoff and a certain score. You get credit also for your overall GPA. You get credit for your T-score. The higher you score, the better. And let's say that you score 75 the first time around, but you want to retake it. You can certainly retake it, because part of that score increases your overall ranking. We can admit a total of 30 students per the Board of Nursing. We are accredited by the Board of Nursing, by CCNE, and CCNE is a long arm, is a subsidiary of the AACN, the American Association of Colleges of Nursing. So we're accredited through them. We're accredited by the Board of Nursing, and then we're accredited by SACS. So SACS is what accredits our college courses. We have a nursing accreditation, and then the Board of Nursing is our credential, which allows us to graduate students and allows the student to sit for the NCLEX. And so those are a lot of accrediting entities, and it's a lot of work to maintain those. I'm just going to put a plug in for our team because there's a lot of work involved in maintaining those also. So once you finish your interview, we calculate your rubric, we notify you that you've been admitted, and the majority of the students are admitted conditionally, often because they're applying for the program during their last semester of school. So they haven't met all the criteria, but that's okay. We still want to interview and get you plugged in, have a plan for you going forward, and but your letter will say it's conditional based on making a B or higher in your final coursework. And then once you're admitted, if you are a transfer student, then you apply to the institution. If you're a Schreiner student, you're already admitted to the institution. But if you're transferred, then we'll include that in the letter, and you'll apply to Schreiner as a transfer student. You'll be accepted there. Once you're accepted at Schreiner, you can register for your nursing courses. The first courses that you will take is a course called Foundations of Professional Nursing and Foundations of Professional Nursing Clinical. You will also take Pharmacology. You will also take Adult 1 and Adult 1 Clinical. And that's your first semester in. You'll be able to self-register once you're admitted and once you're in the institution. And we encourage students to go ahead and register, kind of see what time and what day and their classes are going to be. We host our theory classes in the classroom. We have a designated classroom. And our clinical classes are hosted in one of two places. They're hosted either at a hospital or a clinic or someplace in the community. Could be you could be with a school nurse, you could be with a hospice nurse. We've sent students to hyperbarics, multitude of OB clinics and pediatric clinics. We have about 30 articulation agreements with facilities around Kerrville, Fredericksburg, and San Antonio. So we send our students to San Antonio for their pediatric rotation and for their adult 3. Some students will call adult 3 their critical care rotation because in adult 3, you go into the ICU, the emergency room, and so forth. You do that in some of the other clinicals, but in that particular clinical, that's all you do is those advanced concepts of blood gases and ventilators and some of the things they're talking about even now with COVID-19. That's what you will be doing in your adult 3. Depending on how many students we have, the maximum number we can have with one instructor 10. So that is one of the deciding factors, how many students we have and who the instructors are. And then, our schedule kind of evolves based on what the equation is, and it's a semester by semester scenario. So your clinical also may be in our skills lab. We have high fidelity mannequins. So you have anywhere from no fidelity to low fidelity to high fidelity. A no fidelity mannequin is a mannequin that just looks like a big plastic doll and it doesn't talk to you. It doesn't, you could put a Foley in it, a tube in its bladder. You could put a tube in its nose. You could give it an injection, but it has nothing mechanical. It doesn't do anything mechanical. Low to mid fidelity has a little bit more advanced. You could start an IV on it and give medication, IV medications. You could hang blood on it, simulated blood. You can do a little bit more. High fidelity, the mannequin talks to you at some level. So we have all of the above. We have Noelle who delivers a baby. We have an adult mannequin that can run a cardiac strip. We do CPR on, and who becomes very ill, has seizures and those kinds of things. So some of our skills and our clinical is done in the skills lab because there are various skills that you need to check off on, and then There are opportunities in the clinical site that you may not experience, like for example, seeing a live childbirth. I mean, it's kind of the luck of the draw if while you're at clinical, somebody delivers during that shift, those hours on that day. So we do a simulated delivery, and to make sure that our students get exposed to certain scenarios, 100% to certain scenarios. CPR, you may not get a chance to do CPR in a scenario in clinical, so we do a CPR scenario, and that's just to kind of list a couple of them that we do inside of the skills lab. But your clinicals, some of them will be at the facility and some will be at the school. We also have access to Kerrville Hospital, called Sid Peterson, to Fredericksburg Hospital, which is community. We have access to the state hospital, which they're building a forensic unit. We're kind of excited. I don't know if that's a good way to describe it, but it's a great learning experience for our students. We have the VA hospital. We have Santa Rosa Hospital in San Antonio and then University Hospital. We have about 12 school districts. That's elementary, middle school, and high school. And then we have the Dieter Community Center and some of the other, there's some other clinics affiliated with Sid Peterson and some other clinics affiliated with community in Fredericksburg that we use. We also have 5 nursing homes that are either a nursing home, rehab, or LTAC, long-term healthcare facility. The difference between an associate degree nurse and a BSN nurse, one of the differentiating factors is that a BSN nurse has to have a community health course. They have to be exposed to geriatric. They have to have a research course. Okay, so those are the 3 kind of main differences, is that you have to have community, you have to have research, and you have to be exposed to geriatrics. And we take care of a large population of geriatrics. They're one of the high risk factors right now during the COVID crisis is our geriatrics. So, but for you're not experienced with taking care of geriatrics, maybe you just have a dire desire to do pediatrics or OB, but you still need to leave the program with a well-rounded education for 2 reasons. Throughout your career, the great thing about nursing is that there are a variety of areas that you can select inside the profession. And if you get tired, burned out, want to venture out into another area, then nursing offers that diversity. So we want to give you that foundation and that diversified education initially, because when I graduated from nursing school, I thought I wanted to be an OR nurse. And it wasn't until I worked in the emergency room that I realized I wanted to do ER. And it wasn't until working in the emergency room and receiving patients that were flown into us that I realized I wanted to do flight nursing. So once we expose you to those areas, you kind of will think that you want to work in a certain place until you suddenly work in one of these areas or you have a clinical experience and you're thinking that you just come home really excited. This is what I want to do. This is the area. I finally realized it. This is what makes me feel good. This is what inspires me to learn more. And it doesn't feel like work. It feels like a passion. And so that's what we want you to find your passion. So we try to expose you to as many learning experiences and opportunities as we feasibly can. We're very fortunate. I've taught at about 11 nursing programs in my career. And I'm going to tell you that Kerrville is a gold mine when it comes to clinical experiences. In San Antonio, you can't throw a rock and not hit a nursing student. There's nursing students and nursing schools everywhere. But in Kerrville, we have no competition. And so the hospitals, they vie for our students. And I say that sincerely. As a matter of fact, they want you, they'll try to recruit you. I don't endorse a facility or the other, but they will try to recruit you to come work for them as soon as you start day 1 of clinical. They want you to come work as an extern or nurse's aide or an attendant. They're always looking for staffing. And because you're going into the medical field, they're trying to recruit you early and they'll work with your nursing schedule. But it really boils down to the student and whether or not the student feels that they have that kind of time to be able to, to commit to working. But they'll let you work one day here, a month, an evening, a weekend. And I appreciate that about them because sometimes you might be off on a long weekend or during the summer, and you may want to pick up some shifts. And there's some things to be learned on the job when you're working as a tech inside of the healthcare. And besides, you're making a little extra money on top of it. So it's very rewarding. The things that we recommend that you have when you come into the nursing program are a stethoscope. There are what we call shears. And the difference between scissors and shears, the shears kind of have a protected end, a tip on them so that you don't cut somebody. And there's different versions on the market. A pen light, and they're only good for so many miles, but we recommend you have a pen light because it really functions as a flashlight. Yes, we use it to check the pupils and to look inside your ears and up your nose and open your mouth and say, ah. But we also use it because I dropped something on the floor and it rolled under the bed and I can't see, or I need to look in a closet, or I need to look here or there. So we recommend that you have a pen light. You're going to be wearing black scrubs. And I like to tell you that up front because sometimes you're having a Christmas, a birthday, or some type of graduation event or something along those lines. And if you can ask for a gift card or gift certificate or something along those lines so that you can buy you some snazzy scrubs. You only have to have one pair, but we recommend you have two because you're in clinical 2 days a week and it avoids you having to wash clothes. We request that you have a white lab coat. And it can be of any style, but it needs to look professional. I recommend, whether you're buying scrubs or a lab coat, that you buy something that's easy to wash and wear. Because who wants to iron? And then who wants to show up looking like they slept in their clothes because it stayed in the dryer just a tad bit too long. So we like stuff that the lab coat that I have on is an easy wash and wear. And so you want something that also occasionally you'll spill stuff on it, things like that, because it's white, that you can, remove stains. So just keep that in mind. Sometimes we buy cotton, but cotton is not your friend when it comes to having to be versatile. Your tennis shoes need to be black, but they don't have to be tennis shoes. They just need to be black because your scrubs are black. So we want you in black shoes. You receive a copy of the handbook, and the handbook will once you're admitted, will tell you a lot of these ins and outs. But nursing students and nurses are planners. So we like to know as much as we can understand about the program and what to expect before the program starts. Certainly having a black pen, a red pen, and highlighters in clinical are important because you're going to be taking notes and writing stuff down, some of which you'll need to refer to later. So just being able to write something in red because this is due at the end of clinical, or writing something in black because I just need to take notes because somebody's explaining something to me. So having that kind of equipment when you come to clinical, and even a pencil. A calculator, we usually provide a calculator whenever you take your math exam. You'll take a math quiz for every clinical. That's your ticket to be able to administer medications. We don't let you give medications until you have successfully passed a math competency for that clinical rotation. And any old calculator will do. If your math test is taken at school, we provide the calculator, but once in a while the math quiz is given in clinical during orientation. And if so, then we'll tell students bring a calculator. Most of you have a calculator on your cell phone, but sometimes some of the instructors will say, yeah, but it's got a camera. I really rather not. It's kind of up to the instructor. So it's just a good idea to have a little Mickey Mouse calculator. And besides, what if you're out in clinical and you want to calculate something? Mm-hmm. If you want to figure, somebody brings in a 13-pound 2-year-old, And it's kind of skinny 2-year-old, but let's just say, and you need to convert that to kilograms and because of the medication. And so now you can pull out your calculator, divide it by 2.2. Now you know how many kilograms, and we give, all medications are given to children by weight. Everything, nothing, and it's all given by kilograms. As a matter of fact, in some facilities, it's a firing offense if the child that you're providing care for is not documented in kilograms, and if you medicate other than in kilograms, it's a terminating offense. There are a few things that will get you terminated, but you can certainly cause detriment to a child if you overdose them. And there's a big difference between pounds and kigs whenever you're medicating. So those are some of the items. It looks like I have about 4 minutes. Does that sound right,
It's
Mr.
just about
Vasquez?
that's just
Okay.
about right. You
So
got
I was
about
going
four
to
more
open up to
minutes.
Q&A and see if either you had questions. If not, Michael may have some questions that he may want to ask. So I'm going to be quiet for a minute and see what your questions are.
Now, not to pinpoint anybody, but the only person I see that we have on camera is Rebecca. Now, if you don't have any questions, I don't want to put you on the spot now.
I guess like if I start down one track of like a different program, because I'm just like kind of exposing myself to different areas
Yeah.
and seeing what I'm interested in. Is it easy? Like if I don't like what I'm doing and want to go into nursing, is it somewhat easy to transfer, or do I wait till like the end of the semester or whatever?
I think within your first 1 to 2 semesters, it's fairly easy to switch majors.
Okay.
Yeah, because you're taking some of the very basic. Now, if it's an extreme switch, like if you're, if you're getting a bachelor's of art and you switch to bachelor's of science or bachelor's of science, bachelor's of art, then, you don't need some of your chemistry and some of those kinds of advanced courses for your BA degree. So what you can do is register for courses that are versatile, no matter whether you decide on a BA or a BS.
Okay.
So that's a good question.
So, Becca, do you have any more questions?
No, not really.
Okay. One question I have, and I think this might be a common question you might get, Dr. Sparks, especially, I'm glad I'm actually talking to the director of nursing on this one. Would I, if I was an incoming student or any student, would I be able to work as well as be in this program? What would your suggestion be?
So we have students that work. We do have students that work part-time, and we have students that work full-time. It really boils down to, the student's ability to time manage. We have students who are married, we have students who have children, students who commute. They don't live in Kerrville, but they commute either from Fredericksburg or from San Antonio. It's really student dependent and on what their time management looks like. And so the content, this is a professional program, meaning that the bar is a little higher. This is a program where you get not just a degree, but you have to get a license. So the bar's raised kind of high, and there's a lot of preparation that goes in getting, you think about going to law school or to medical school or to dental school, and at the end they have to take the bar or the medical exam. You're taking the nursing exam, and so there is a lot of preparation, and it depends on your time management and your energy level, and not just your physical energy level, but your bandwidth. How much do I have, like they say you're either a night owl or a lark. So you're either somebody who stays up late and that's your best retention time, or you get up in the morning and you're singing to the dog and talking to everybody. Hey, good morning, everybody. And so I don't know, Michael, if you're a lark or a night owl, but you have to think about your bandwidth. And am I at work during am I at school during the day? But I'm really a night owl, but that's when I work. but I have to study during the day, but that doesn't go with my circadian rhythm.
Exactly.
And so, I can try to study. There's just, usually you get to know yourself and you know when your best study time is, how to approach studying. And even with that being said, I've talked to a couple of students this semester that I'm teaching and a student that I interviewed that were admitting into the program in the fall. And they've talked to me about how they studied one way for the first semester in nursing school, and they suddenly get into some courses. Well, for example, I teach obstetrics. So I'm teaching OB this term, and this is a male student, and he doesn't have babies. And so he doesn't have that anatomy. So it's very different for him. And he is not a female, so he can't pull from even his own personal anatomy. And so he's had to study extremely hard in this OB class in a way that he's never had to study in his life. He's rewriting almost all of the chapter definitions because this vocabulary is new to him, and he's looking a lot of vocabulary words up online. So he's had to really change his study process. But yes, it's feasible to work. It's just going to depend on what you and how you approach your study and your work, your time management. Are you familiar with Generation Z?
No, not
Yeah.
really.
Okay. Well, you're Generation Z. Or do you know what a baby boomer is? A Generation X, Generation Y? Okay, you're Generation Z. So I've been here about a year, and so I'm still assessing and updating and making improvements in the program. One of the gaps I identified is that we weren't addressing Generation Z. So Generation Z is a little bit more, not everyone's, and one stereotype, but they don't want a long email. They want something that's short, like a text. All right, get to the point. What do you want? Me to come over? Me to meet you? Starbucks? Okay. So I've switched some of our textbooks over to a product called F.A. Davis. What F.A. Davis offers in their product is they address Generation Z. So in their product, they have short videos that are cartoonish, not in a silly way, but in a way that gets my attention. Certainly you have the textbook. So you're going to read your textbook. You're going to watch these little vignettes, these little videos that, okay, I don't have the energy to read right now, but I will go on and listen to 4 or 5 of these little videos. They have the ability for the book to read to you. So you may not want the whole chapter read to you, but you know what? I didn't understand this part of the lecture. So you can have the book read to you. Maybe you have a little bit of a drive from point A to point B. You put your book on and you have that part of the chapter read to you. So I think the redundancy and the ability to have redundancy, and we call it learning preference. We used to call it learning style, but it's now called learning preference. Your learning preference may be audio, maybe visual, kinesthetic, but if we're hitting audio and visual with the lecture and with the reading, kinesthetic with the clinical, then hopefully you're getting it in enough sensory elements that it sticks. But even with that, kinesthetic learning, you say, well, how can I do kinesthetics? This isn't PE. Kinesthetic learning is writing things out,
Yep.
not typing them out. Because some of the homework assignments, when students have to remediate, we require that they're written out. I can't read them, most of them, but I had to tell them you need to write it out because that's your kinesthetic learning. So the student I spoke to earlier is having to do a lot of kinesthetics. He's having to write stuff out. And so you might find that you need to write flashcards, or you need to write out on, on a notebook, old school. It just may require redundancy, having to do it more than once and then more in one way.
Okay.
All right.
Oh, I have a question.
Yeah, by all means.
First, my name is Zane, by the way.
Okay.
I was wondering what advice you have to give to athletes, because I'm going up there to play basketball, but I also want to be a nurse and do the nursing program. And I remember my coach telling me that it's kind of difficult doing it, but it's not until like your junior senior year. So I needed like, what advice would you give to like my freshman year and sophomore year to like prepare me for my junior year? To, like, see if I want to keep playing basketball, if I want to like quit and just focus on just straight nursing.
Yeah, so you can be an athlete and you can be in nursing school. It creates some additional, just like working, just like folks that may have dyslexia or may have, it creates some additional scheduling and so some additional work on your behalf in order to be able to meet the requirements, the course requirements. And so it's doable, but I think giving yourself, the first 1 to 2 years in, and it'll give you an idea about the time management and give you a flavor for the time management so that when you get closer to your junior year, then we can explore what it will look like for you specifically. As as an athlete, what days your games are on, and how many are out of town, and all that kind of thing. So yeah.
Okay. Thank you.
Thank you.
Great.
Well, Dr. Sparks and everybody else, it looks like we're right there at the time. Does anybody have any last minute questions whatsoever? And if not, Dr. Sparks, do you have any last pieces of advice or anything you'd like to say in closing at all?
The only thing that I will say is that nursing is not necessarily, it's a career, it's a job, but it's a passion and it's a calling. And so it's going to be very tough to be a nurse if it's not falling into that passionate domain and that calling. I have a brother who's an accountant and he's very successful. And when I first became a nurse, he said to me, I don't know how you do it. I mean, there's germs and everybody's sick around you. And I just don't know how you're able to do it and to take care of those people. They're complaining. And I said to my brother, Larry, I said, I love it so much, I could do it 8 days a week. I wish there was one more day in the week. I just can't do it enough. So if you feel like you're going to fall in love with this kind of work, it's not going to be work. It's going to be your passion, and you will thoroughly enjoy your entire career. You'll enjoy what you do. You'll feel good when you go home every day. There's a few days you might talk to yourself on the way out to the car because it's been one of those kind of days, but you're gonna feel really good about what you do. Every day you have the opportunity to make somebody's life better, and you'll cross paths once sometimes with people for 5 minutes, but you get a chance to make a difference in that person's life. So that's what I'll close with.
I couldn't agree more with that. It hits home almost. But if anything, I wanted to say thank you for everyone joining here today for a Shriner University live stream. I just want to remind you, you're more than welcome to reach out to any one of us here at Shriner, even if it is 10 minutes after this conversation, this live stream. You reach out to us even on the weekend. You're not bothering us. If anything, we are here to help you out every step of the way in becoming a future Shriner University Mountaineer. Again, you can reach me or anybody in admissions at admissions@shriner.edu. You're more than welcome to reach out to us. But other than that, I hope you have a great rest of the day and a great weekend.
Yeah, thank you. It's nice meeting you all.